Hi, I'm Rick Jaime, firefighter EMT with the Mesa Fire Medical Department. I'm here today with my paramedic engineer partner Thad Hunter, and we're here to talk about one of the most critical calls that we run on, which is a stroke. Thad?
Yeah, stroke is one of our most prominent calls that we go on. It's the number 4 killer of Americans right now in America. And what we wanted to kind of run through is maybe some signs and symptoms that you might want to look for if you think that someone might be having a stroke. We use an acronym called FAST. The F stands for facial droop, so what you do is have them smile, and if their face wasn't symmetrical, then that would be a sign. A is for arm drift. You'd have them hold their hands out like this, and if one of them kind of sank down like that, then that would be another sign. S is for slurred speech or difficulty speaking. A lot of times they won't be able to talk, and that's another critical sign. And most important is time. Time is of the essence. The sooner that we get treatment, the better off the patient's outcome will be.
That's a great point, Thad. And one thing we want to stress is after you do call 911 while we're en route, one of the things that we really need to determine is when was the last time that that patient was seen acting normally without the signs and symptoms that Thad described. So while we're en route, determining that time is very important, as well as some other things you can do are gather the patient's medications if they take any medications. Now we want to stress not to give the patient any food, any water, or any of their medications, but when we arrive there, if you can have a list of their medications or the actual medication bottles, that's very helpful too. Some other information that you can gather is any medical history that the patient might have. Have they ever had strokes before? That's good information for us to know. Do they have a cardiac history? Do they have any respiratory problems, asthma, things like that? All this information we're going to gather at the time once we arrive on scene, and we're going to share that with the hospital when we're en route. Thad, do you have anything else to offer?
No, I just want to stress again, no food, water, or medications. Part of people that have a heart attack, they give aspirin, and that's one of the medications we don't want to give to a stroke patient. So that's kind of what Rick was getting at without doing that. And again, time is most important. The quicker that we can get treatment, the better off your outcome will be.
Well, thanks again for watching. If you have any questions or want to leave us a comment on Facebook, feel free to do so, or send us a tweet. Have a great day.